All right, we're doing post assessment education. Um, all right, so before the assessment, we did a health history and decided to teach on because your family does have a history of having an MI or a heart attack or heart disease. So we're just going to teach about decreasing the risk for that and what you can do to kind of help um, high blood pressure and what kind of risk factors can factor into that and just what we can do to help monitor it and prevent it. So first, just talk about hypertension, which is high blood pressure. Um, it can be present without any symptoms. So you can have high blood pressure and then not know it. Um, it's important to monitor it regularly to determine if prevention measures need to be taking place, like medication, diet, exercise, weight loss, anything like that. Because uncontrolled high blood pressure can lead to heart disease eventually. But it's important to, like I said, to monitor it regularly. So I'd recommend getting an automatic blood pressure device. That way you can monitor it regularly yourself and then still do like regular checkups and let your doctor know if there's any changes or anything like that. And you can get one of those at local pharmacy. And then this can give you the ranges. So like pre-hypertension range is from like 130 to 139. Systolic, which is the top number. And then 85 to 89 diastolic is the bottom number. And then hypertension would be considered anything above 140 systolic, which is the top number again, and anything above 90 diastolic, which is the bottom number. And then you can always ask your physician or pharmacy, or they got directions included with the packaging, I'm sure, on exactly how to put on and make sure you measure the blood pressure properly. All right, next we'll talk about diet. So a heart-healthy diet can help lower the risk for heart disease. So it just focuses on intake of foods rich in nutrients to help lower the blood pressure, like potassium, calcium, magnesium, protein, and fiber. So these can help, they can help maintain like or they can help you lose weight, but it can also help you maintain like a healthy weight, depending on portions and things like that, which can help lower the risk of heart disease. Some examples of like foods you can eat with like different groups. So like your grains, you can eat like whole wheat bread and rolls, whole wheat pasta, bagels, cereals, grits, oatmeal, brown rice, and then like unsalted pretzels and popcorn, stuff like that. Vegetables, do broccoli, carrots, collards, green beans, green peas, kale, lima beans, potatoes, spinach, squash, sweet potatoes, all those. Fruits, apples, bananas, apricots, grapes, oranges, grapefruit juice, mangoes, peaches, raisins, strawberries, and then any type of milk products you want to get low fat milk products because anything low fat because you don't want anything with your cholesterol because cholesterol you can have high buildup and that can lead to heart disease. Well, you always want to keep a check on it. Just do like a every month, every so many months or yearly checkup. Just keep an eye on it. Make sure your cholesterol levels are doing good. But just like fat-free or low-fat, 1% milk, buttermilk, fat-free, low-fat, or reduced fat cheese, and like low-fat yogurt, frozen yogurt. And then lean meats, poultry and fish is the kind of meat you want to stick to. It's a lot of fish. And then if you want to trim away any visible fats on the meat, and then broil, roast, or poach it, and just make sure you remove the skin from the poultry, stuff like that. Nuts, seeds, legumes. You can do almonds, hazelnuts, peanuts, walnuts, sunflower seeds, peanut butter, kidney beans. to make sure the peanuts and all that aren't salted. Um, Fats and oils, you want to kind of do like a soft margarine and vegetable oil, canola oil, corn, olive, low fat, mayonnaise, like light salad dressing. If you do like salad dressing on salad, light salad. And then fruit flavored gelatin, fruit punch, and like hard candy, just like low fat sweets. If you just had a sweet tooth. But foods that you should avoid is just any foods that are like high in saturated fats or high in sodium, like a lot of salt. You want to make sure that you kind of stay away from like sweets like cookies, candies, salted nuts, sodas, a lot of sodas, sugary beverages. Then you always want to check the label and nutrition facts on stuff that you buy at the grocery store to make sure that it doesn't have too much trans fat, saturated fat, sodium on it when you're buying it. And then you want to try to avoid alcohol, but if you don't, you drink it in moderation. And then you want to try to avoid tobacco products as well, because those can definitely create some risk factors for heart disease long term. And then let's talk about exercise too. You combine the heart healthy diet with regular activity. That's just a recipe to help prevent, because it can also help prevent or help weight loss, which can help prevent heart disease as well when you combine those two. But any type of walking, swimming, just activity for like 30 minutes a day or 5 times a day, and then you can even break it up to like little 10 minutes. Just do it more often. Just make sure you're doing a good amount or a decent amount of just average physical activity a day, and that can help you avoid